This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Good morning. I'm Dr. Rob Page, and welcome to another podcast episode of Doc Talks. Doc Talks is a podcast that's produced by the Knoxville Academy of Medicine and features our members, our member physicians in the community, and topics that they would like to discuss. And I feel so fortunate this morning that I have with me Dr. Rosalind Cadigan. Dr. Rosalind Cadigan is an OBGYN here in Knoxville and has been practicing here since 1996. Is that right?
Yes.
And the topic that Dr. Cadigan would like to talk about this morning is labiaplasty. Mm-hmm. Dr. Cadigan, what is labiaplasty?
So labiaplasty is a surgery that's performed on the labia to usually shorten the labia for women that have concerns in that area.
Now, why would they have concerns in the area? Why would they need to be thinking about surgery such as this?
So some women have very long, excessive skin in that area, and some women have asymmetry in that area that really distresses them. If the labia are overly long, it can get trapped in their underclothing or in bathing suits. It can be painful. It can be painful during intercourse, and it also just makes them feel different.
So this is not only just because I know that the way that a lot of us have heard about labiaplasty is in reality TV, on TV shows like Botched. I know where they talk about designer vaginas and doing this strictly for a cosmetic purpose, but it is not just a cosmetic procedure.
No, it definitely isn't. And so if you're a young woman and you put on a bathing suit and you can't wear it comfortably because your labia actually comes down out of the leg of your bathing suit, that's more of a problem than just cosmetic surgery.
Most assuredly. So now, this is a surgery that you can perform on women at any age, or is there a particular age where you like to start thinking about performing these type of surgeries?
So you have to be careful with this surgery because a lot of young women will start really noticing their bodies and the differences in their bodies quite young, like even as they're going through puberty. But the entire genital region does not mature oftentimes until in the 20s. So I usually encourage people to wait until they're 20, 21 before they start looking into having this procedure.
So if I'm a 21-year-old and this is a procedure in which I'm interested, and I go visit, and you'll go visit you, the OBGYN, what sort of questions should I ask to the OB? What sort of things are important for me to ask the OB?
Well, the number one thing, of course, would be, do you have experience doing this? The other thing would be to ask, am I normal? Like, does this look normal to you? Is it something that you can fix? A lot of girls will ask me, am I being oversensitive about this? And then questions about how am I going to look after this after surgery? What restrictions am I going to have? And long term, what will things look like and what will function be like?
Now, I know one of the things that we discussed before we got on the podcast was about the concept of what is normal, because I think that there's a lot of, certainly online, there's so much information out there about what looks normal, what is normal, what's appropriate. How do you generally approach issues like that with the patient?
So I believe women are much more aware of their anatomy now than ever before. It's not uncommon for women to go to the internet if they're wondering if they look normal or not. They'll go to the internet and look at pictures. So we're much more aware about our bodies now. One thing you have to be very careful about that you have to think about when you see a patient is if they have any problems with body dysmorphism. Okay. And that means women and men can have it too, but in my case, women who are never satisfied with the look of their body. They see their body different than everybody else does. Right. And that's a patient that you have to be very careful with, because no matter what you do, they're rarely happy with it. And it's not their fault. I mean, it's a different sort of issue, but they're really happy with it, and oftentimes it leads to multiple surgeries.
So, and body dysmorphia is a condition like we see in anorexia or bulimia, things like that, where you have an I would not say abnormal, but just a different idea of how you should look normal.
Right. I like to think of it as somebody who looks in the mirror and does not see what everybody else sees in that mirror. They just see a total different version of themselves than anybody else sees them.
Gotcha. So well, let's say I'm a patient, and let's say I'm in my 20s, I'm the right age to do this, and I come visit you, and we decide that surgery is a good idea. What does the surgery involve?
So there's two different ways to do the surgery. Traditionally, surgeons have just kind of held the skin of the labia up and used these scissors called Metzenbaum scissors just to cut the skin away.
Now, is this something you can do in the office, or do you have to do this in the operating room?
Sometimes you can do it in the office. I usually like to do it in the operating room. That area can be very vascular.
So you would be under anesthesia
You'd be
during
under
this?
anesthesia,
Okay,
yeah.
gotcha.
That area can be very vascular, meaning it can bleed a lot. And also, you need the patient to be very still because there are very tiny sutures that go in there, so you want to do the best job you can. I'm not a fan of just cutting them off, we'll say, because that will lead to a long scar that goes up just on the outside of the labia on each side. It's a big scar, it's painful, and also you're removing the pigmented skin in that area. So if you want to look normal and you just want to have shorter labia, you don't want to remove that pigmented skin.
Gotcha.
So I do a procedure, it's called a wedge resection. And so when I have a patient put to sleep, I take a marker and I figure out how much excess skin is there. I mark it out, and then I cut a wedge shape out of the labia, kind of from the center of the labia, and then I join it back together again. So you have normal pigmented skin. You have a tiny incision that goes on the outside and the inside of the labia, but they're small incisions, and it's usually a lot less painful.
So it would be important for me to know if I were to go see, going to see you as an OB, I know what kind of procedure you perform, but it would be important for me to know whether or not the surgeon would be performing a trim procedure or a wedge procedure.
Right.
And is there, and if, and so you prefer the wedge procedure, and for the reasons that you stated. You said, faster recovery time, less scarring, typically keeps the anatomy more normal, keeps the pigmented skin there.
And they often don't have problems with intercourse after. Some women, when they get the other procedure done, can have problems with painful intercourse.
Understood. So if I were to have this procedure done, how long would I need to wait before I was able to resume normal activities?
So for the first 2 weeks, you have to be careful not to do exercises like lunges. You have to stay out of pools, and you can get into a bath, but I don't allow people to get into pools. You have to be just kind of gentle with that area so it doesn't get stretched and break the stitches. Most women are back to normal function in 6 weeks.
And that would be, and so that would include being able to, so would intercourse be something that you would generally delay even longer? Or?
No, 6 weeks usually they're back to intercourse, and most women are back to work after a week or two.
So it is actually a procedure that you would actually have to plan for. You'd not just be able to walk into an office and have it done. You would need to make sure that you planned this out, went to you beforehand, had a consultation, ready to go to the operating room. Now, is this a procedure that insurance usually pays for, or?
Some insurances do, especially if the woman has pain because the labia are excessively long. Some women, if they want it done because they've had weight loss and they have excess skin there, some insurances might cover that. I'm afraid to say the bulk of insurances do not.
Yeah, well, that would be mainly because they consider it more of a cosmetic type.
Yeah.
Which
they don't understand that it's actually a functional pain issue.
Absolutely, because of the problems that exist with, having long labia and the twisting and the turning and the problems with doing things like riding a bicycle and intercourse and things like that. So I've consulted you, I've had the surgery, and now I'm fully recovered. What other follow-up should I have after a procedure such as this?
So I'll see the patient back at 2 weeks and then again at 6 weeks. That's standard. After the 6-week mark, then they just come back for routine care. So their yearly annuals, or if they're having any problems, they generally do not have problems in the labial area after that. There are some patients, it's rare, but there are some patients that may need little minor adjustments after the surgery. So if there's one area that still looks a little longer or something didn't heal right, and that usually can generally be looked after in the office.
Now, what if I'm planning on having children? Is this something that would affect my ability to have children, or affect, would I still be able to have a vaginal birth, or would I have to have a C-section? Or...
That's a great question. It should not affect your ability to have a baby at all. So you should be able to have a normal vaginal delivery. There's nothing about this surgery that should interfere with anything in your life afterwards.
Gotcha. So after the 6 weeks recovery time, essentially, we would come back and see you and follow up, and other than that, everything would be great.
And it's an extremely rewarding surgery to do, because most women come back and they are so ecstatically happy. It's amazing.
I was going to imagine. So, well, is there anything else that you'd like to add about this procedure, or anything else that you'd like to make sure that if patients are looking to get this procedure, if they should make sure and ask their doctors, or anything crucial that you think that is important for patients to know before they consider getting this procedure?
Well, I would say if a woman is wondering about this procedure and they ask a doctor about it and they feel like they were dismissed, then they should look for another consult, because we see that happen as well. There are different disciplines that will do this surgery. Plastic surgeries will do it. There are some gynecologists like myself that do it. The biggest reason I chose to discuss this topic today is because it is the #1 cosmetic surgery performed in the United States right now.
Wow.
So there's lots of this happening everywhere. And I feel like women need a good source of information to go to.
Understood. So, well, you talk about being a good source of information. Dr. Cadigan, you practice here in the Knoxville area. Can you give us information about your practice if we would like to consult you about having a procedure such as this?
My practice is, I operate out of Park West Hospital. I'm not employed by Park West Hospital, but my husband and I have a practice adjacent to Park West Hospital in a building called Physicians Plaza. We're called OBGYN Professionals of East Tennessee. The phone number is 865-531-3303.
Well, I'd like to thank you so much for joining me here today. We've certainly learned a lot about that, and certainly given us great information about things that we need to do in pursuing this. As this is not just a cosmetic procedure. It's something that's important. It's something that it's important for women to know that exists.
Absolutely.
And for them to be able to have good information for.
Absolutely.
Thank
you for having me.
Well,
I appreciate it.
Thank you. That concludes this episode of Doc Talks. You have the information that should have appeared at the bottom of your screen if David put it on there. So it should be. David says yes, he's going to put it on there. So it should have appeared on the bottom of your screen. You have the information to contact Dr. Cadigan about any further information. And with that, I'd like to thank you for joining us on this episode of Doc Talks. I'm Dr. Rob Page, and you guys have a great day.
Have a good day.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.